Beyond that, I just want to go directly to issues of support and care for those 3,000 residents who are in the 9 public housing towers that are the subject of an unprecedented and very challenging, hard lockdown. It is very important that we make sure that we contain the virus and that we can control the movement of everybody in those towers unless and until they are tested. That process is well underway, and it's my expectation that each and every one of those residents gets tested, and that the sooner that's done, the sooner we have those tests taken and the results back from the laboratory, the sooner we can assess the results and then make judgments about what rules, what sort of restrictions, what treatments need to be applied to those who have the virus, who reside in those towers, and those who do not. Staying inside your flat, inside your unit, is the safest and best thing to do. It's not pleasant. I know it's challenging. It's very, very challenging. But it is far preferable to seeing vast numbers of people with underlying health conditions infected with this virus, spreading it between each other, and the inevitable tragic outcomes that would come from that. I said yesterday, and indeed the day before when we announced these arrangements, that it would be a massive task, and it is fair to say that no element of this is easy. I want to reassure everyone in those towers, their family beyond those 9 towers, and indeed every single Victorian, that there are literally hundreds and thousands of people working, from police to social workers to nurses and doctors, all the way through to people working in our supermarkets, people working in commercial kitchens. There is many, many hundreds, and indeed it runs into the thousands of people, and they are all doing their absolute best. It doesn't make it any easier. It is very challenging to stand up something as quickly as this, but it's based on the best public health advice. It is the only option that the government had to do that important work of containing the spread. Every single person, and there are many of them, are out there doing the very, very best that they can. And we'll continue to work hard every hour of every day over this 5-day period to get to every resident the support that they need and to get every resident tested. That's the real key to giving us options and potentially having a different set of rules once those 5 days pass.